Assalamualaikum. I am Dr. Sadia from Pathology Department. I will discuss chronic inflammation today. I will discuss how to define it, how to differentiate between acute and chronic inflammation, its causes, role of macrophage and lymphocyte interaction in chronic inflammation. Chronic inflammation is a response of prolonged duration, weeks or months, in which inflammation, tissue injury, and attempts at repair coexist in varying combinations. Here we can differentiate between acute and chronic inflammation. When a patient comes with acute tonsillitis, for example, he gives you short duration history. For a few days, he is having a sore throat, high-grade fever, pain in throat, and dysphagia. And in chronic inflammation like tuberculosis, patient present with low-grade fever, weight loss, and chronic cough for months or year. Talking about onset, acute inflammation is fast, starts within minutes or hours of injury, and chronic inflammation onset is slow. Predominant infiltrate in acute inflammation is neutrophil, while in chronic inflammation, monocyte, macrophages, and lymphocytes predominate. Tissue injury and fibrosis may be severe and progressive in chronic, while local and systemic signs are more prominent in acute inflammation. Here are some of the examples of chronic inflammation. For example, arthritis, atherosclerosis, pulmonary fibrosis. All of these are examples of chronic inflammation, and lymphocytes and macrophages predominates, while in asthma, eosinophil predominates. Causes include persistent infections, as you have already studied. Unresolved acute inflammation evolves into chronic inflammation. Certain microorganisms like mycobacteria, viruses, or fungi often evoke immune reaction called delayed type hypersensitivity. The inflammatory response sometimes takes a specific pattern called granulomatous inflammation, which is prototype of tuberculosis. Chronic inflammation plays an important role in a group of diseases that are caused by excessive and inappropriate activation of immune system, and in autoimmune disease, self-antigen evoke a self-sustaining immune reaction that results in chronic inflammation and tissue damage. Examples are rheumatoid arthritis and multiple sclerosis. Other causes of chronic inflammation include allergic diseases and prolonged exposure to potentially toxic agents such like silica and endogenous cholesterol and lipids that cause atherosclerosis in blood vessels, Alzheimer's disease, metabolic syndrome, and type 2 diabetes. All are examples of chronic inflammation. Morphological features. Chronic inflammation is characterized by the following: infiltration with mononuclear cells. Here we can differentiate between acute and chronic. Predominant cells are macrophages, lymphocytes, and plasma cells, while in acute inflammation, neutrophil predominates. Tissue destruction is more in chronic inflammation, and attempts at healing and repair is a morphological feature of chronic inflammation. Here are blood cells. We can have an idea. Neutrophil trilobed with trilobed nucleus predominates in acute inflammation, while lymphocyte, monocytes, and macrophages predominates in chronic inflammation, and eosinophil is particular for parasitic infection and allergies. Here, H&E stain of tissue shows bilobed and trilobed neutrophils in the tissue, while here mononuclear cells predominates in the tissue. So this picture is example of acute inflammation, and B picture is example of chronic inflammation. This graph shows as disease progress, inflammatory infiltrate changes from neutrophils to monocyte macrophages. These two pictures, A and B. B picture shows alveoli with congested blood vessels and with neutrophilic exudate. Here are some bilobed and trilobed polymorphs within the alveoli. But in picture A, arrows point towards fibrosis that is characteristic of healing and repair. Here are some lymphoid aggregates, chronic inflammatory cells, and there is widespread destruction of alveoli. You can appreciate here, there are alveoli. You can see outlines of the alveoli, but here all the alveoli are destroyed. Cells and mediators of chronic inflammation. Important cells are macrophages, lymphocytes, mast cells, eosinophils, plasma cells, and neutrophils when it's acute or chronic inflammation. Mediators of acute inflammation you have already studied. Now we will discuss mediators of chronic inflammation. The most important is interferon gamma that is produced by T lymphocytes and natural killer cells. This interferon gamma acts on macrophages and activates it, while interleukin 12 is produced by macrophages. They act on T cells to produce more interferon gamma. So this is a feedback loop. T cell sends signals to macrophage to activate it. Macrophage sends signals to T cell to activate them. Interleukin 17 is important for the recruitment of neutrophil when it's acute or chronic inflammation. Role of macrophages. The dominant cells in most chronic inflammatory reactions are macrophages, which contributes to the reaction by antigen presentation to the lymphocytes. They are professional phagocytes. They secrete several cytokines and growth factor. They destroy foreign invaders. They are effective cells in immune responses, and they serve many other roles in inflammation. Here's the story begins. Microbes crosses the natural barrier. This is the skin, and first interaction is with dendritic cells and macrophages. Macrophage phagocytose and release mediators that cause vasodilation and increase permeability. Diabetes occur and macrophage goes to the site of infection or injury or where there is microbe, and they try to engulf it and digest it. Meanwhile, mediators are released and healing and repair coexist with inflammation. So where they come from? There are some macrophages which resides in the tissue for ages. They comes from yolk sac and liver in the embryonic period. Residing cells in the liver are called Kupffer cells. In lungs, they are called alveolar macrophages. In CNS, they are called microglia. During inflammation, macrophages are derived from blood monocytes. They activate there and produce several mediators. The half-life of blood monocyte is about 1 day. So, macrophages become the dominant cells within 48 hours on onset. There are two major pathways of macrophage activation: classical macrophage activation and alternate macrophage activation. Classical macrophage activation is important in chronic inflammation, while alternate macrophage activation is important for healing and repair. Classical macrophage activation is induced by microbial products such as endotoxin, which engage toll-like receptor and other sensors. T cell derived signals, importantly the cytokine interferon gamma. Classically activated, or also called M1 macrophages, they produce nitric oxide and reactive oxygen species, and they upregulate lysosomal enzymes, all of which enhance their ability to kill ingested organisms. They secrete several cytokines that stimulate inflammation. These macrophages are important in host defense against microbes. While alternate macrophages are activated by interleukin 4 and 13, they are called M2 macrophages, and they are important in tissue repair. The products of Activated macrophage eliminate injurious agents such as microbes and initiate the process of repair, but are also responsible for much of the tissue injury. They release several mediators. They release cytokines such as TNF interleukin 1 that is important for fever producing mechanisms. These macrophages are central to initiation and propagation of inflammatory reactions. Macrophages displays antigen to T lymphocytes and response to signals from T cells. Here is classical activation of macrophage from monocyte. By binding of microbes or by interferon gamma, it becomes classically activated called M1 macrophage. They upregulate their radioactive oxygen species and lysosomal enzyme. Those are important for microbicidal action and phagocyte killings. They also secrete several mediators and chemokines that are important for propagation of inflammation. Here are some differences between neutrophil and macrophages. Neutrophils are important in acute inflammation. They reside in the tissue for a few days, while some of the resident macrophages live in the tissue for ages. They secrete several cytokines, and cytokines production is less in the neutrophil. Where there ever is the chronic inflammation, lymphocytes plays important role in granulomatous inflammation and in autoimmune inflammation. Here we will discuss CD4 T cells. Three subsets are important. First one produce interferon gamma, which activates macrophage by classical activation. Other produce interleukin 4 and 5 and 13. That is important for eosinophil recruitment. Th17 is important for recruitment of neutrophils. So Th1 and 17 are involved in defense against many types of bacteria, while Th2 cells are important in defense against helminths and parasitic infections. This is the feedback loop between macrophage and T lymphocytes. They talk through these mediators. First interaction of antigen with the macrophage, it becomes classically activated. It produces several mediators, chemokines, TNF, interleukin 1 to propagate inflammation. It also produces interleukin 12 that activates T lymphocytes. Also, it presents antigen to T cells to activate it. When T cells become activated, it also releases several mediators that are important for propagation of inflammation. They also produce interferon gamma to activate macrophages. So this feedback loop is important for propagation of inflammation in chronic inflammation. Lymphocytes and macrophages, they interact bidirectionally. They crosstalk. T cell produce interferon gamma to activate macrophage, and macrophage produce interleukin 12 to activate T lymphocytes. Activated B lymphocytes resides in the tissue and they resemble the follicles found in the lymph node. They are called tertiary lymphoid organs. For example, in rheumatoid arthritis and HASHIMOTOS thyroiditis. Here there are germinal centers can be seen. These are the thyroid follicles. All the lymphocytes resides in the germinal centers. Eosinophils are important in allergies and parasitic infections. Eosinophils have granules that contain major basic protein, a highly cationic protein that is toxic to parasites but also injures host epithelial cells. So this is the interaction of eosinophil with parasite. It becomes attached to it and release of major basic protein that is toxic to parasites. These red staining cells are eosinophils. Mast cells are widely distributed in connective tissue and participate in both acute and chronic inflammatory reactions. Mast cells arise from precursors in the bone marrow. In immediate hypersensitivity reaction, Ig bound to mast cells Fc receptor specifically recognize antigen, and in response the cells degranulate and release mediators such as histamines and prostaglandins. There's, these mediators are important for rhinitis and all the nasal secretions. So while someone having allergic disorders, it's important to give them antihistamines. This is the interaction of antigen with IgE. They cross-link, degranulation occur, and histamine is released. Neutrophils are important where they are present in chronic inflammation. It's called acute on chronic inflammation. In chronic bacterial infection of bone, a neutrophil exudate can persist for many months. Neutrophils also are important in chronic damage induced in lungs by smoking and other irritant stimuli. This pattern has been called acute and chronic. This is a gross picture of normal gallbladder with paper-thin mucosa, green granular. While this is chronic cholecystitis with cholelithiasis, these are the gallstones in the sac-like structure. You can appreciate here thickened wall due to fibrosis. Healing and repair coexist in inflammation. That's why this wall is thickened. This is the histological picture of normal gallbladder with mucosa muscularis, mucosa, and this is the chronic cholecystitis. Mucosa is infiltrated by chronic inflammatory cell infiltrate. All these small dots are chronic inflammatory cells. When you come across with bilobed or trilobed leukocytes in the tissue, it's called acute inflammation. So in stomach, it's called acute gastritis. There are lymphocytes and macrophages present in the tissue, so it's called chronic gastritis. A 36-year-old man has mid-epigastric abdominal pain for the past 3 months. Upper GI endoscopy showed 2 centimeter ulcer. Biopsy of ulcer shows angiogenesis, fibrosis, and lymphocytes and macrophages. So what type of inflammation is this? With lymphocytes and macrophages, it's acute inflammation. A woman who is allergic to cats visits a neighbor who has several cats. During the visit, she inhales cat dander and develops nasal congestion and nasal secretion. Which of the following is most likely to produce these findings? It's histamine. Which of the following substance is most likely to stimulate monocyte and macrophages? It's interferon gamma. Thank you.